dear colleagues, in this video I have a pleasure to introduce my preferred technique for surgical correction of valgus deformity of the foot. This is an osteotomy of the anterior part of the calcaneus with the opening of the wedge. Indication for opening wedge osteotomy of calcaneus are well visible on this screen. This is a 39-year-old patient with a valgus fit as a consequence of posterior tibial tendon insufficiency greater on the right side. We can see on both sides diminished push of power. This is a second part of clinical examination. Test for gastrocnemius muscle, test for tibialis posterior muscle, and range of motion in subtalar joint. Radiological appearance of the right foot before operation with a Maris angle on AP and lateral radiographs. The operation begins with the elongation of the gastrocnemius muscle. The patient is lying on the operating table in a supine position. Access to the muscle is between the middle third and the distal third of the shin. The muscle is cut transversely. It is also worth cutting through the tendon septum shown on the video. The next stage of operation is opening wedge osteotomy of the anterior part of calcaneus. Lateral approach, mini Olliers. Fibular muscle tendons are visible and retracted. And detachment of extensors digitorum brevis. Location of osteotomy is about 1.3 cm proximal from the calcaneal cuboid joint. Osteotomy started with the help of the saw, so as not to lead to a fracture of the calcaneus. And then with the help of a chisel. It is a good idea to use the Hintermann device to open the osteotomy site from lateral. The next stage is to take the bone graft from the lateral malleolus. The incision, it's above 2 cm its top. This is possible even in children and adolescents. Then it is done just above the gross cartilage. This can be treated as a kind of stimulation of growth cartilage. The downloaded fragment has a shape of triangle. It also has a strong cortical layer. The downloaded fragment has the shape of a triangle. It also has a strong cortical layer. It's a bit like the bone graft we take from iliac crest. After inserting bone graft, osteotomy site is very stable. You can make sure of this by making intense pronation and supination movements. Post-operative treatment is typical. It is clinical appearance after surgery of the right foot. Open wedge osteotomy can be combined with several different procedures visible below. Dear colleagues, I hope you found this video interesting. Thank you for your attention.